Which epidemiological trait component is most crucial in preventing vector-borne disease? Correct answer is option C, environment. Which approach is most effective in the prevention of non-communicable disease in a community? Correct answer is option A, health education. In primary health care, which principle emphasizes community involvement? Correct answer is option D, community participation. Incidence rate refers to. Correct answer is option B, only few cases. Which of the following disease is best monitored by sentinel surveillance? Correct answer is option A, malaria. Which vitamin deficiency is commonly addressed in National Nutritional Anemia Control? Correct answer is option C, iron. The major cause of maternal mortality in developing countries is. Correct answer is option C, hemorrhage. Which is not a component of PHC as per Alma Ata Declaration? Correct answer is option C, organ transplantation. Which indicator is best for measuring the impact of a family planning program? Correct answer is option C, total fertility rate. The best way to interrupt the transmission cycle of hepatitis A is through. Correct answer is option C, improving sanitation. Which vaccine is administered subcutaneously in the National Immunization Schedule? Correct answer is option C, measles. Disability limitation is best represented by which action? Correct answer is option B, preventing complication. Which strategy is not part of directly observed treatment short course for TB? Correct answer is option D, mass chemoprophylaxis. Which of the following is a propagated epidemic? Correct answer is option C, influenza. The most sensitive index for assessing nutritional status of a community is. Correct answer is option B, infant mortality rate. Which is the most effective method of refuse disposal in rural areas? Correct answer is option C, compositing. What is the most appropriate indicator of the effectiveness of a malaria control program? Correct answer is option D, slight positivity rate. Which is a live attenuated vaccine? Correct answer is option C, measles. The incubation period of hepatitis B is approximately. Correct answer is option C, 1 to 6 months. A key feature of the demographic cycle in developing countries is. Correct answer is option B, high birth rate and falling death rate. Which of the following is a secondary prevention measure? Correct answer is option C, early detection of disease. Which of the following is the most reliable method of contraception? Correct answer is option D, sterilization. What is the vector of filariasis? Correct answer is option C, Culex mosquito. Which index is used to measure the burden of chronic disease? Correct answer is option A. Cold chain is maintained to preserve. Correct answer is option A. Potency of vaccine. What is the minimum chlorine concentration required for effective water disinfection? Correct answer is option B, 0.5. What is a behavioral risk factor for NCD? Correct answer is option D, smoking. Which of the following is not a component of RCH, reproductive and child health? Correct answer is option C, cataract surgery. Which component of health education is considered most effective? Correct answer is option C, interpersonal communication. Which level of prevention involves screening programs? Correct answer is option B, secondary. The first contact point between individual and health system in rural India is. Correct answer is option C, sub-center. What is the basis of AIIMS strategy? Correct answer is option C, syndromic approach. The National Program for Blindness Control emphasizes. Correct answer is option C, cataract surgery. The term sentinel surveillance is best associated with. Correct answer is option C, selected site monitoring. The standard calorie requirement for an average adult male per day is. Correct answer is option C. What is the function of ASHA in NRHM? Correct answer is option C, health facilitator and motivator. Under the AIIMS protocol, a child with pneumonia is classified by. Correct answer is option B. Which disease is targeted for elimination, not eradication? Correct answer is option C, leprosy. The denominator used in calculating maternal mortality ratio is. Correct answer is option C, live birth. Which vitamin is given every 6 months to children under vitamin A prophylaxis? Correct answer is option C, vitamin A. Which health worker is responsible for immunization at the sub-center? Correct answer is option B, ANM. A population with high birth rate and low death rate is in which stage of demographic cycle? Correct answer is option B, late expanding. Most common cancer in females in India is. Correct answer is option D, breast cancer. Which of the following is not covered under Universal Immunization Program? Correct answer is option C, typhoid. Midday meal program was introduced to combat. Correct answer is option B, protein energy malnutrition. What is the frequency of National Family Health Survey in India? Correct answer is option C, every 5 years. The head of a primary health center is. Correct answer is option C, medical officer. Which of the following is an essential component of water quality surveillance? Correct answer is option D, all of the above. What is the key purpose of a home visit in CHN? Correct answer is option C, health education and care. The expanded program on immunization was launched by WHO in. Correct answer is option B, 1974.